Good afternoon. My name is Corina Herrera Loera, Public Information Officer for the Emergency Operations Center here in the Santa Clara County. Today, we have our guest, Dr. Solorio Cortes, who will be joining us shortly. But before we go there, I'm going to go over a few updates for our county. So as many of you know, those of you who are connected and look at our dashboards daily or every other day when they are updated, our COVID-19 daily update is 85.9% of those 12 and older that are vaccinated with at least one dose, and then 80.3% of our 12 and older population have completed the vaccination with both doses and or the one. And our new case 7-day rolling average is 309 cases, positive cases for COVID. Next. And just an update, most recent update that we have in our county. This is broken down by ethnicity, by age, by gender. Again, you can go to our website and look at that information as we have it updated in our county. Next slide, please. And so here, this is new information for this week in regards to our additional COVID-19 shot, the booster shot, also known as booster shot. We do have our doctor, as I mentioned, he will be going more into detail in regards to the booster shot, but there are now residents in our county who are available for that booster shot. And like I mentioned, our doctor will go over the details, but soon, right now it's only open to those who are immune compromised and a few others, but soon they may open it up for the rest of us. So we'll go over that more in detail once the doctor comes on. Next slide. And so a lot of us have children who have begun school or are maybe in their first day today or are going to be starting soon. Here are 3 reasons why we should vaccinate our children, those that are able to get the vaccine, 12 and older. As we know, it protects our kids from COVID-19 disease. It protects anyone who gets the vaccine from getting a severe symptoms or even death. So that's a huge reason. Next slide, please. And then the unvaccinated students who have to quarantine will miss out on sports. An example of this is my stepson. He plays for a local community college, and unfortunately, a couple of the students, a couple of the players tested positive, and now the entire team had a quarantine. And so those that are vaccinated are able to come back sooner. You know, there's certain quarantine for those extra days for those that do not have the vaccination. And so again, unvaccinated students who have to quarantine will miss out on the sports piece, those that are playing. And then the routine testing is not needed for any kid who is fully vaccinated. So that'll also prevent, I know my daughter, that was one of those things. She's like, oh, Mom, I don't want to take that test again. And so those who are fully vaccinated won't have to take that routine testing if they are fully vaccinated. Next slide, please. And so here's our list for the vaccinations. The sites this week, we have several like we do every week. The big ones continue to be the one at the fairgrounds, but there is a location near you. This, again, I know it's small, but this is more to highlight the fact that there is a vaccination site near you. Please go to secfreevax.org. All the details are there. You can make an appointment or you can show up. There are plenty of walk-in places that you can continue to go to and get your vaccine. And or there are places that you can have an appointment if that works best for you to go. We have a combination of early morning, late night places, and also places that are open during the weekends to make sure that we're able to cover all of our residents. Next slide, please. And so here's one of our sites, specifically, those of you who live on the east side of San Jose. This one is at the Story Hub Service Center, which is at 1775 Story Road. And if you're familiar with that area, Story and King, and there's a Cárdenas store there. There is a tower with a clock on it, and it's right under that door. So if you're familiar with that area, you can go there. Fridays from 3 to 7:30 p.m., Saturdays and Sundays from 9 a.m. to 4 p.m. For the vaccinations. And then also testing is available there Mondays and Tuesdays from 10 to 3 p.m. and then Fridays from 10 to 2 p.m. Next slide, please. And then this is another new opportunity here in our county, the Small Business Grant Program. And so we have an opportunity for those with small businesses. We know that unfortunately our small businesses have been those that have been impacted the most. And so we do have small grant programs that is supporting our businesses. And so if you're interested, the deadline to apply is September 7th. You can, after the community forum ends, you can rewind and get the information there, or you can come through our Facebook pages and get the information and or call 211 if you weren't able to get any of that. That's probably the easiest. If you remember 211, call and ask for the details. We're happy to give that to you. Next slide, please. And then last but not least, our resources for our county. Again, we continue to provide resources. As I mentioned, those that need testing, those that need the vaccine, but then also maybe those that tested positive for COVID, if they need support in quarantining, if they need any assistance in finding out the details, maybe about how long do they have to quarantine for, et cetera. Or even, when do I need a doctor's note? Or can I go to work? Can I not? No question is a dumb question. Please make sure to call and ask. This is new for all of us. And, some of us, things change day to day. So we get it. If you don't know something, please ask. That's we're here to help. We're here to support in the various languages. Also, if there's any need for food assistance, we also have that. So if there is any need or any question, please call us. 211 is the easiest number to remember. Otherwise, we have this list of different phone numbers available. I know, again, it's a small font, but I wanted to make sure that I put it out there to ensure that you knew the different resources, and more that our county provides, especially here at our public health, to ensure that our community is not just healthy, but also covered to ensure that our basic needs are met. And so with that, I'm going to go ahead and I think that was the last slide. If you can go to the next slide just to confirm. I'm pretty sure it is. Yes. And with that, I'm going to go ahead and bring in our Dr. Gerardo Solorio Cortes, who's joining us from the Santa Clara Valley Medical Center. We're happy to have him here. Thank you, Dr. Solorio Cortes, for joining us. I'm going to go ahead and turn it over to you so you can give us an update as to where we're at in our county.
Hi, everyone. Good afternoon. Again, my name is Dr. Gerardo Solorio Cortes. I'm a primary care doctor at Valley Health Center in Gilroy. And today is a great segue with Karina has been saying. The best thing we could do to combat this pandemic is to get vaccinated as soon as possible. So anyone who's above the ages of 12 years old, if you haven't, gotten vaccinated, please do so as soon as possible. In the news, you will see the differences between the unvaccinated and vaccinated. And you will see that people that are having more hospitalizations, more deaths, are those that are unvaccinated. The percentages are reaching at 70 to 90% of those being unvaccinated being in the hospital, with minute vaccinated people also being hospitalized. So as soon as possible, whenever you can, please do so, get vaccinated. And then I do want to give updates, as you've probably seen in the news, with the FDA and the CDC regarding boosters and third vaccination. So let me first break it down for the third vaccination. And I'm using that term because the CDC and the FDA actually use that term, and they call it an additional vaccination. And we're talking about the immunocompromised individuals. So those individuals that started off with the series of the mRNA vaccines, being the Moderna or Pfizer, that individual that did the whole series, the 2-shot series, is fully vaccinated. But as Karina has mentioned, this pandemic has pretty much given us, every day, every week we learn something, and what we're learning is that these individuals um, get more protection out of having a third vaccine. So these individuals are going to qualify for this third additional vaccine. Some of the specific patients that I'm talking about is those individuals that are going through cancer treatment, those that have gone, for example, also kidney or liver transplant, also stem cell transplant. Those individuals that are going through that will qualify for this third vaccine. And lastly, individuals that are taking medications that suppress their immune system for other conditions such as rheumatoid arthritis, lupus, Crohn's disease, gastrointestinal diseases. Those also will fall under the category of this group that will qualify for the third vaccine. Now, some of you may be asking about the J&J vaccine, and if this group got the J&J, is there a second J&J vaccine that's available? And at this moment, there isn't. But CDC and FDA is looking at it in terms of what we're gonna do and what we're gonna offer to those individuals. There are some county cities that, for those that receive the J&J and fall under this category of immunocompromised group, then a second dose mRNA, um, Moderna or Pfizer will be good. Will be good in these individuals. So more to come on that. And then lastly, you probably in the last 48 hours, you heard that officially, when it comes to a booster, and again going between the Moderna and Pfizer, starting September 20th, CDC FDA announced that certain individuals, and I guess, and I'm thinking we're going to start with the healthcare workers, um, elderly people in nursing facilities, just the way we started in January. After 8 months, the studies say that the antibodies wane, or meaning they decrease. So that's why officially a third booster will be recommended in this group, this first group. And again, I'm talking about the same ones that started in January: elderly, nursing facility, healthcare workers. And after 8 months after your last second dose of Moderna or Pfizer, you would qualify. And again, as a reminder, September 20th is when that is going to be get started. More to come from your doctors, your healthcare systems. I know I work for the county, and we're looking at how we're going to be administering these vaccines. So keep an eye out for these community group forums, and also the county website. And lastly, I've talked about the vaccination and the updates from the CDC and FDA, but it just to close it, as what Karina has been mentioning, is still don't forget to mask, do this, physical distancing 6 feet, be in a well ventilated area, avoid large crowds. That's still recommended. And again, number one is get vaccinated. Get vaccinated as soon as possible if you haven't so. Thank you.
Thank you, Doctor. And now I'm going to open it up to the questions and comments of those that we have that have joined us. So if you have any questions for the doctor, please put it here. We'll do our best to get through them all. I'm going to start with Reina Branzuela. She says, but yet the vaccinated are still getting and giving COVID. So I think good point. You just closed off, Doctor, with we should all wear masks. Very true. Reina, thank you for joining us and for your comment. It's true. We are still getting and giving COVID. Therefore, we have the mask mandate right now. ensuring that.
And what I would add, Karina, too, is I think it's an
Mhm.
important point is that it's a new pandemic. It's called novel coronavirus. So scientists, doctors, we're learning as we go. Um, Things change, day by day, week by week. There are facts. The facts is that what we're seeing in the hospital and the deaths that are occurring right now is those that are unvaccinated. Those that are vaccinated, yes, there are breakthrough cases, but the data, the science, the updates from all these county agencies, state agencies are saying that they are mild cases, not needing a hospital stay. When all this started, different views from different scientists. One of the big views from top scientists was, okay, we may not prevent COVID in that certain individual, but at least let's make it a high percentage where that individual is not going to end up in the hospital. And those percentages are still high, and that data is still saying that if you're vaccinated, the likelihood of you ended up in the hospital or dead is very low. The percentages, just throw them out there: 0.1%. The latest data that I've seen, where someone becomes sick, and it's very, very low when you compare it to the almost 200 million people that are fully vaccinated.
Mhm. Thank you. And then Lisa also just kind of reiterated what you just said. Vaccines just lessen the symptoms, not prevent you from getting it, just like any other vaccine. So yes, thank you, Lisa, for joining us as well. Dawn, we have Dawn, who's asks, vaccinated people can still become sick, so why should they be excluded from testing? And they're not excluded from the entire testing.
Right.
I'm sorry if you misunderstood that. What I meant when I talked about the children is that there will be, as far as I know, I think most districts will have a weekly testing. I know it's in the works for different districts. So don't quote me, but I know there will be a testing for students who are not vaccinated. Kind of similar to those employees that are not vaccinated as well. For example, in the county, we had at one point those that are not vaccinated. We needed to do a weekly testing and submit the results, and so similar. But yes, we all should get tested if we have symptoms of COVID. Absolutely, we are not excluded from getting tested if we have the vaccine. And then we have Lillian Rose. Yes, but they tend to have much less severe symptoms. Thank you. Yes, the information that the doctor just stated. Lisa, they aren't excluded from testing. Correct. Nobody's excluded. We all should get tested if we have symptoms. Reina, again, I don't trust a vaccine person just as much as unvaccinated. Thank you for your comment. We respect everybody's comment. Thank you again, Reina, for joining us. We have Dawn, Lisa, Collins. Well, it's not being required. Thank you. We have Reina again. They shouldn't force it on people who simply choose not to take the vaccine. Talk about trying to take away people's rights. Not sure who's doing that. We're not trying to take people's rights here, but we are encouraging everybody to get the vaccine to prevent COVID-19, severe symptoms, and death. We have Lisa. Yep, but most people would rather have mild symptoms than being hospitalized or on ventilators. Absolutely. Again, we respect everybody's thoughts and opinions. I'm trying to get to the questions, doctor, because I want to take advantage of your time. Let's see. We have Chris. You mean like the schools already require vaccines for measles, mumps, rubella, polio, TB, etc.? Yes, they should require vaccines. Thank you, Chris, for joining us. Reina, again, my brother and my aunt both had COVID and I was around them. Why didn't I get COVID? There we go, doctor. Question for you.
Well, I mean, I would want to hear more information. The CDC says that it's more than 15 minutes, less than 6 feet in a 24-hour time frame. That qualifies as a close encounter. So that would be one question. How much time were you with that individual? Was there a mask, not a mask? Was there vaccine, no vaccine? And yeah, So some individuals, and we've seen this. I mean, some people will not um, get infected being around someone, but the data says that we don't want to take that chance, meaning that there's enough data to say that the 6 feet, the masking is still going to be better than, you know, being around chancing someone that's, you know, actively infected. But yeah, some people will not, you know, get infected, and that's more to the studies and more to find out why is it. Um, just with any other condition in any other disease, some people are more susceptible, some are not. And the question for us scientists, doctors, is like, why is that? And it's more to come, I would say. But
Thank you.
everything still stays the same in terms of we're still recommending the vaccines and the social distancing and masking that we're still recommending.
Thank you. All right, and we have Simon Gordon. He's asking, are there any updates on vaccinations for children under 12?
Excellent question, Simon. And you know, just like you, I'm also looking forward. It's pretty much the studies are being done right now, and you know, listening to the administration and also the CDC, FDA, we're looking at fall, winter for that to happen. So I think they're moving as fast they can. But again, going back to um, effectiveness and safety, they want to ensure that the right dose is given um, to that population. You know, the 12 and younger. So those studies are currently being done, but hopefully soon we will know um, when we could give them.
Thank you. Then we have Lisa again. She asks, really? My vaccinated son was required to get tested for school when a teammate tested positive, so not sure where you're getting your information. The difference was that vaccinated students can still go to school and not miss a week in quarantine. Thank you, Lisa. Yes, so every district, every school, CSUs, community colleges, elementary schools, the districts, uh, different ways of doing, and you might even see them changing within the next week or two. I do understand that CSUs, I think, recently announced that they are mandating their students to get vaccinated. So things can change, Lisa. I'm glad that your son sounds like he was required to test. I'm glad for his safety and those of others and their health to ensure that the spread of COVID doesn't happen at their schools. So yes, that could be very true in your school, and things can be very different for, again, community colleges, CSUs. So yes, thank you again for joining us. We have Chris again, who says the vaccine companies are still testing in 2 to 12-year-olds. Results are expected in the late fall. Thank you, Chris. I think also what the doctor just said, we're hoping that, to get those results soon and be able to vaccinate our younger ones too, our younger children. We have Katie Kearns, who responding to Reina, vaccines over 90% effective at preventing severe illness, hospitalizations, death, better than we could have ever hoped for. That was a stated efficacy. They succeeded. Thank you, Katie. Absolutely. And I think, it will take many times for us to repeat that information, for us to understand the importance of getting vaccinated. Again, we're not in a place, it's not mandatory, nobody's rights. We're not talking about that. We're talking about people's health and ensuring that we are healthy here in our county and overall. So I will do my best to go through the questions. If I see, let's see, partially that is because they need to adjust to dosage for smaller children, and partly because they really wanted to make sure the vaccines were safe before starting testing with children. Example, they didn't benefit from overlap of stages that sped up adult testing. Chris, yes, thank you. I don't know, next time we should also have you as a guest maybe here. Thank you for joining us. Reina, I think some people are immune to COVID. As the doctor mentioned, they are in the process of studying that. And wouldn't that be wonderful if you were one of them? Chris Cox, you can only be immune if vaccinated or had a previous infection as asymptomatic, but immunity still drops over time. Thank you. Amy Laurel, individual differences. I work in SNF and everyone got COVID and I did not. However, I I'm terrified maybe of injections. I'm not sure. Something injections as soon as possible in December. Thank you, Amy. Kamala, if these are 6 feet, avoid crowds. The recommendations, why are schools still open? Doctor, do you want to take a shot at this?
I think just reading what the county has been doing, the school districts, it's weighing the benefits and risks of having children in a in-person setting, the risk of COVID, and what they're doing is, from my understanding, is masking, for example, trying to do activities as much as, or the crowding as much as possible outside, not inside. The 6 feet of distancing, and one of the announcements I was seeing from the school district is anybody who has symptoms to not go to school and get tested. And these county school districts have plans in place where once one is identified, to try to test close contacts, going, and you're right. I mean, they're gonna have people are gonna have to go back very detailed and see who is in fact a close contact. Um, and I've read in the news, Florida, other states where they have been outbreaks, there have been contacts, and people have been quarantining at home for days. So um, I have faith, I have trust in the county, the school districts, and what we're doing. Um, and again, time will tell if what we're doing is safe, and if it's not, again, I go back to our county and officials um, doing the right thing in terms of if needing to put more restrictions, then that's going to be the case. But again, it's a day by day thing, week by week, figuring out what is our case rate. Thank you.
Thank you. Thank you. Okay, and we have Angela Vidal. Are vaccines for kids the only way you will remove the mask mandate? Good question. Doctor, I don't know if you want to take a shot at this, but obviously we are not the ones with the power to do that. So
It's a good, excellent question, and it's more of the health officials, county officials, the county governance, state, city. Um, a lot of it has to do with the case rates, the infectivity, how bad a variant is. And right now, studies do show that Delta variant is more contagious. For example, a study noted that if you look at the particles of virus, there's, if the original strain was one, and just to make it simple on everyone here, so if the amount of virus was one back in March with the original virus, now with Delta, you're at 4,000. The amount of virus in that nose or in that the lungs, the respiratory tract. So that data is what's driving all these recommendations. And when things get better, settle down, and we see that there's um, safety, or that it's not as bad as it is right now, Delta, then the county and the state officials will make those changes.
thank you. And we have Karen here who says September 20 comes, I would be due for a booster in November. Can I sign up for November and December? So I'm thinking she's asking if she can sign up for a booster shot in November and December. So Karen, at this point, we're only doing those that are immunocompromised, as the doctor mentioned earlier. And so at this point, if it's today, if the answer today is not yet, but know that things may be changing. And so you just stay tuned for any new announcements. As the doctor also mentioned, we're looking at possibly extending the third one, and it may include a time frame. So if you got one, I don't know, let's say in January, maybe by certain dates. So stay tuned. Right now, the answer is not yet. but stay tuned for when we do open up for that booster. And doctor, I don't know if you want to add anything else to that.
I agree, Corina. This is like fresh off the press news from yesterday. Even in our county system, we're going to figure out what will be the best way to accomplish this. Is it going to be currently at the county system? We have mini vaccination sites in certain Valley Health Center clinics. For example, there's one in Gilroy and one at Tully. And there's also still a mass vaccination site at Expo Center. But then the question would be like other non county patients, where do they go? Kaiser, Stanford, other sites. So that's still being worked on, and I'm sure we'll let you know when that's going to be available to you. But you're right. They're saying that 8 months. If you're past 8 months, then you do qualify for this third vaccine booster.
Thank you. Okay. And then we have Melissa, who is asking, if someone had COVID in November 2020, are they still okay to be around unmasked if I am vaccinated? Are they still okay to be around?
So excellent question. So vaccinated. So if you're vaccinated, masking is still recommended at this point. And why? There's the Delta variant. So and let me give you a hypothetical scenario. Let's say you're vaccinated and you also got COVID, or you suffered through COVID back in November. So the question now will be, well, what if you're infected with the Delta variant? You'll have no symptoms, but still be asymptomatic, still have the virus, and you have a 2-year-old around you, or someone that's immunocompromised, with maybe chemotherapy and didn't get a good response just because of that, being with chemotherapy, didn't get a good response with their vaccine. So they're not protected, but yet you come around not wearing a mask. And so that's the potential. And that's the reason of why mask is still, it's another tool to pretty much try to settle what's going on right now with the contagious Delta variant. Excellent question.
Thank you. And then we have Simon here again. Thank you. Angela, well, if enough adults vaccinated and we got the cases down, then we could take away child mask mandates. Kids only get infected if there is circulating virus. No vaccines reduce the chance of getting and reduce the chance of spreading, just like any vaccine. Thank you. We have Aisha Hedge, who is asking, do pregnant women also need a booster shot, doctor?
Aisha, thank you so much for that question. I'm going to have to go look into it, but preliminary data show that the series, Moderna, Pfizer, was okay in pregnant women, women lactating still. So, and you're right, it's a booster shot. But my gut feeling is that since everything went well, I mean, what I'm saying is like the benefits of vaccination was more positive, that this third vaccine is going to be okay in this population as well.
Thank you. And then we have Antoine here. Regardless of vaccination status, if you have been exposed to a COVID positive case, you should be tested on day 5. Thank you, Antoine, for that information, for being here. Angela, what data point will we need to hit in order for masks to no longer be required on children and as an alternative be a parental choice? Doctor?
I think we kind of answered this question a few minutes ago in terms of like having the county officials, the clinicians, public health, and governments in terms of looking at the case rate. And again, going back, this is looking at severity, looking at hospitalizations, looking at deaths by population. You're right, by county, by state. As you know, you could look across the United States and see, how different things have rolled out. And I think the government, gave that leeway because some some communities are going to be more vaccinated than others. Some communities are going to have less cases, and that's going to dictate how much restriction or not that community is going to have. So again, it's more of a higher level decision from county health and county law.
Thank you. And we have Melissa. Should people who had COVID last year get vaccine? Do they need one shot or two shots? And Melissa, great question. Thank you for bringing that up because I think a lot of people still don't have the clear information. So I can't wait for the doctor to answer this question.
Yeah, thank you. Excellent question, Melissa and Karina. You're right. We've probably answered it a few sessions ago. Point blank, if you have become infected with COVID-19 ever, you're not protected. Meaning, in terms of like the immunity, it doesn't give you a free ride. No, studies have looked at it, and the antibodies are actually better long term with the vaccine versus natural infection. It is for that reason that CDC, FDA, and scientists, doctors still recommend that anybody who has been infected, once they're out of quarantine, 10 days, 14 days, 21 days, if they're hospitalized, as soon as you're out, you qualify for the vaccine. And we recommend any of the three, J&J, Moderna, Pfizer. And for Moderna and Pfizer, yes, finish off the series. And if there's a third booster, which I've already said, it's going to start on September 20th, yes, you finish off the series as well. Because studies have, without a doubt, said that vaccination will give you a more robust, meaning a more stronger immune system, antibodies for future protection of COVID and its variants.
Thank you, doctor. And we have Chris who stated what you just said. And I think the only thing that I will add is they just need to wait a few weeks or months after the infection. Yes, thank you so much. We have Kamala here again. Should you not mandate same process to for all students? And I'm not sure, doctor, do you know what she's talking about? Or I'm not sure what the process is. Maybe the testing?
Yeah, I would need more clarification
Yeah.
on the question.
Yeah, Kamala, if you can ask your question again, we want to make sure we get to your questions and make sure that we understand them as far as what you're asking. I don't want to make assumptions. I'm thinking the testing, but I could be wrong. So I'll wait for your question. Let's see, Anupama, why do physical stores have the max indoor people count and distancing, but classrooms don't have, especially for under 12? You want to take a shot at that, doctor?
I would, again, this is more school district, question. I don't have a good answer for that.
Mhm.
So yeah, I would probably go back to the school district with that question.
Yes, and the only thing I would add is I know, for example, my daughter's classrooms, there's definitely a lot more than 12 students, or but they have dividers, so they do have things in place to prevent from mixing, I guess, or the symptom from passing from student to student. And so, but yes, I agree with the doctor. Every school district has its leaderships and the reasons for. So I agree. I would suggest you go back to your school district, the student school district that they belong to, and ask them. And then we have Daisy Garant, vaccines and pregnancy. How do you balance the risk with pregnancy in people who are otherwise healthy? Most pregnant women are afraid to get the vaccine with all the unknowns, side effects, and general mildness of the disease. We have seen lots of people get period irregularities, and that scars pregnant people from getting the shot. Also, which vaccine is best? Doctor?
Excellent question. Thank you, Daisy. The data is out. We know this that in, pregnant women have a more likelihood of a severe case of COVID. So for that reason, um, it's a high risk. We would kind of categorize it, meaning that we do know that there's more severe disease. So we recommend highly on these individuals. With the
Thank,
CDC, FDA, when you get your vaccine, there's a website where you could input your name and when you got the vaccine. It's called V Safe, and through that and other avenues, the CDC, FDA has gotten thousands of data from pregnant women since in January, and the jury's out that the benefit outweighs the risks. A question would be, are there more miscarriages with the vaccines? From my knowledge, what I've seen, talking about Johnson and Johnson, Moderna, or Pfizer, and none of them showed a higher risk of miscarriage, for example. So I'm giving you some evidence that these are all three vaccines, to my knowledge, Moderna, Pfizer, and Johnson are effective and safe and highly recommended in women who are pregnant. Definitely.
thank you. And we have Erin, the smoke is awful outside and with doors open and windows open in classrooms. It's kind of difficult now. The kids have masks, but it doesn't help. I can only imagine, Erin. Hopefully, you're able to get a device in your classroom that helps the air flow better with the doors closed and windows closed. We have Rose Vasquez. My teen received her Pfizer booster a few days ago. So far, no issues. Since school resumed with no social distancing in place inside a classroom, the availability that the county had and the fact that they implemented the booster vaccine plan so fast was so helpful. Stanford Kaiser and PAMF are still not giving the booster vaccine appointments yet, but Santa Clara County has the booster available. Thank you, county public health officials. My only question is, when will our tiers change again? Thank you for your question. Yeah, that's a good question. Hopefully, we don't have to go to the tiers. Hopefully, we get our vaccines. We're able to get our cases under control and back to a number that where we were at, right? I think we got to the single digits, if I remember that, at some point, or close to. So looking forward to that, where we don't have to go to tiers. But if again, the numbers, if they go and the state sends us in a different direction, then we get to also follow the state orders. And so yes, good question and good points. Thank you. I'm glad that your team was able to receive her Pfizer booster and is able to go to school. All right, we have Swati here. If a kid is in close contact to a kid who is diagnosed COVID positive, will both quarantine? How they will study? Any online option for them? I think this is a question for the districts. And what I'm seeing is a lot of the questions are related to schools, which, of course, I can see why. A lot of us have questions. Our kids just started school, so I think it's letting us know that our next community forum should be focused on schools again, and we get to bring somebody from maybe a couple of different districts and our Santa Clara County Office of Education to ensure that we answer those questions. Unless you have something to add to that, Doctor, for now. Let me unmute you. Sorry.
Thank you, Corina. Excellent questions that people are asking, and you're right. I think at the next forum, we should have representatives from the school districts to help us with these questions.
Thank you. Okay, we have Anupama. Where is the dashboard for the pediatric cases being maintained? I don't know that there is one, but Doctor, maybe there is. Can you tell us if there is one and where that's being maintained?
Sorry, unfortunately, I do not know, um, you know, how it's divided or where it's kept. But I think at the next meeting, at the next forum, we could probably share the information.
Yes. I know that there is data available. I don't know that we have it on the dashboard, but I can get the numbers for the children's cases in our county. So I'll make sure to bring that. Again, I don't think it's a dashboard that's available right now or that's updated. Okay, we have Kamala again. When the adults are unvaccinated with a less deadlier strain, we were on lockdown, but now we are open with more deadlier strain and putting unvaccinated elementary school kids in. Thank you for your comment. Chris, there absolutely is a way to test for Delta variant. All the existing tests will still recognize the Delta variant. To tell the variants apart, you need RNA sequencing, which normally isn't done per patient, but for broad group sampling, it is slow and expensive. Do you want to add anything to that, Doctor?
Yeah, I mean, the county, it does run random, detailed genetic tests, and the evidence, says that 80 to 90% of what's the variants that's currently now is Delta. So for all intents and purposes, um, at this moment, and like I said, things could change tomorrow, next week, if another variant takes, you know um, there are more cases of that variant, and the county has a system where they do testing randomly on that genetic sequencing to figure out if it's a Delta or is it a Lambda variant or a Gamma variant.
Thank you. Okay. And we have Angela again, Chris, exactly. So what data is used by the Santa Clara County to determine the rules they put in place when private and public schools? So again, good question regarding schools. So we'll make sure to bring somebody that can speak on those. Linda is asking, why are kids who've been exposed to COVID not being tested or required to quarantine? We know that vaccinated can asymptomatically spread the virus. Doctor, if you can.
Yeah, and again, going back to this is the third time we're saying that we should probably have a county educational official next at the next meeting, because that is one of the recommendations is quarantining, testing. That was actually one of my fifth points that I wanted to mention is still continue to test if you're having any symptoms, if you've been exposed, if you're worried, you may have been exposed, may have not been exposed. Somebody's quarantining. I mean, testing is still out there and still recommended. Vaccines don't equate to you're done and no more need for for testing for actual active COVID. That's still out there. We still are promoting that when that situation arises.
Mhm. Thank you. And then we have Rose here who's asking around masks, and I'm going to paraphrase because I know we have a few minutes and we have a few other questions about the price on the masks, the face masks. And she's wondering if the county and government agencies will help consumers with the price gauge. So good question, Rose. I don't have an answer for you right now, but I'll go ahead and, ask. That's a good point. And I think definitely also a point to, call, call and ask and, bring that up because some of us might not be looking at those details. I know that we have no control over, well, we can't, you mentioned Amazon and that, is not necessarily something within Santa Clara County. But I think the bigger issue is the availability of face masks and ensuring that everyone has accessibility to a face mask. And so I think with that, I can say, absolutely, let's do something about it because if the mandate is to wear face masks or that's what we're being encouraged to and people don't have access to one, then we definitely get to do our part to help make sure that that's available. I know at the districts, I know the schools are providing face masks. So let's make sure that all of us have the face masks available for us to use. But thank you, Rose, for joining us. We have Marisa Navarro. What are the options for people who had heart inflammation, severe immune system reactions from first shot of mRNA vaccine? I'm one of those people, and frankly, I'm frightened to continue with a second shot. I had Pfizer. Doctor.
Thank you, Marisa. Excellent question. We have Johnson and Johnson as an option. I do know for a fact that, for example, when I'm vaccinated in clinic, people that have had or have an allergy to the actual product of Moderna, for example, they have had anaphylaxis to an item in that vaccine, then I would recommend Johnson and Johnson. So that will be an option. So definitely talking to your primary care doctor or your cardiologist, trying to help you out in terms of what will be the safest route you could take. I totally understand the concern. Again, going back, I would probably have a discussion with your primary care doctor. Maybe the J&J, since it's a different type of vaccine, will be an option for you.
Thank you, Doctor. And we have Rose again, who states her district, San Jose, now requiring testing. It's disturbing. There's so much, yes, going on. And again, we'll bring somebody that can maybe, one from Santa Clara County Office of Education that oversees the entire school. We also have Angela, who's asking about education. So good questions. We'll have somebody at the next community forum from the Santa Clara County Office of Education to be able to speak on behalf of the schools within Santa Clara County to ask all your questions. And Monika, and I guess just to answer this, who is the Department of Education contact with the county? It's Santa Clara County Office of Education. You call there, and again, somebody there will be able to help you if you have any specific questions about and anything related to education in our county. But we will have somebody here in 2 weeks, and you don't have to wait till then. Of course, feel free to call Santa Clara County Office of Education. Monika, any ideas when the shots will be available for under 12? I know we mentioned earlier, Doctor, there's studies happening. There's not a definite date, but we're all hoping for the fall sometime is what the studies are possibly showing. Is that true, Doctor? You want to add anything to that?
That's pretty much it. We're looking at fall, winter, hopefully.
Mm-hmm. Yes, thank you. And then there we have Monika again. I've heard as late as September. Is that accurate? So as we mentioned right now, we don't have a definite date, but I'm looking forward to hopefully happening soon. All right, we got through our questions before 3:30, the 1 hour mark, Doctor. Do you have any closing comments for us? Any closing messages before we end today's community forum?
It was an excellent forum today. I think the audience pretty much took my final statement from the questions that they asked. So thank you so much for the excellent questions. Again, if you haven't become vaccinated yet, please do so as soon as possible if you're above the age of 12 years old. Thank you and have a great day.
Thank you, Doctor. And we got one last comment in before we finish. I do want to mention it. It's from Marisa Navarro. Thank you for your response. I did speak with my primary care physician and they were of no assistance. They just reiterated per CDC that mRNA vaccine is safe for everyone 12 and up. I'm feeling very confused and I don't know how to proceed. So thank you, Doctor, for your information. Being available every month to be here on this community forum. I appreciate your time and thank you all for joining us. Thank you all for taking the time out of your busy days to tune in and hear what the updates are and hear what the doctor has to tell us. Thank you so much. Have a great rest of your evening. Good night.